Welcome to Startup Health Now, the podcast where we celebrate the innovators and entrepreneurs building the future of health. I'm India Edwards. On this episode, which was recorded live on the floor of Health in Boston in October, Startup Health's Logan Plaster sits down with Shay, the CEO and co-founder of youturn. Shay and his team are working to fight addiction by making addiction treatment resources more accessible. They recognized that it isn't just the addicted person who is affected, but a wide community of friends and family. So they're working with employers to address problems early and to respond to addiction as a community of support. Shay comes at youturn as both a serial entrepreneur and as someone who has struggled with addiction. That combination of tactical and personal experience has helped the startup secure important early partnerships, which Shay discusses in the interview. Enjoy.
All right, Shay Hauser, CEO of youturn. Thanks for joining me on this very special episode of Startup Health Now podcast.
Man, it's great to be here. How about us at the health show? I mean, this is kicking it.
We got people walking around. We're in this plastic booth. It's good times.
It is good times. 6,000 people registered, I think is what I read. It's phenomenal. I mean, this is an amazing venue, a lot of people, and just having a blast talking to a lot of companies doing some great stuff across healthcare, and I've been blown away with some of the technology that I've been seeing. It's cool.
Awesome. Well, yeah. Shay, I want to talk about your company. I want to talk about youturn. I want to talk about sort of your recent moves, collaborations you've had, but then also talk about broader trends you're seeing here at the show and elsewhere in addiction care and where that intersects with mental health care and digital health. So for all of our listeners, why don't you just start by telling me a bit of your origin story. I like to start with the challenge. You know, what was it about healthcare that you saw that was broken, that you said, you know what, I'm going to take the risk. You were a startup founder. It's significant risk to step into this market. What was so broken that you said, you know what, I got to be a part of this solution?
Yeah, well, for me, I was broken. Okay, I mean, I was having challenges inside of drugs and alcohol. Call it addiction, call it whatever you want, but as I, went through my career over the last 30 years, I was always an active, alcoholic, if you will. I was an equal opportunity drug user. I rarely saw a drug I didn't like. They all looked good to me. But I managed to keep things kind of in between the lines, and what that meant was I was able to, I think, help build companies and create value, and because of that, I was able to get away with things that maybe some people wouldn't be able to get away with. But eventually, my story is like a lot of others that struggle with drugs and alcohol, and too many relapses led to the family intervening, and I ultimately went to treatment. And since that time, I've gone through treatment 3 additional times. So I've been in rehab 4 times. I've spent about 6 months inside of institutions sort of dealing with these things, and a lot of it, quite frankly, stemmed from some sexual trauma I endured. I was abducted by 3 guys about 15 years ago and beaten and robbed and sexually assaulted. And I didn't really uncover a lot of that stuff until I got to treatment the 3rd time and really started to dig deep into some of the anxieties and fears and worries that I was having. But ultimately, Logan, when I left treatment, more than anything, I saw how my experience in and out of treatment, relapses, impacted my 16-year-old daughter at that time. And she was my youngest child. She was still in high school after I had relapsed and gone to treatment. And she was in private school and just simply struggled mightily with, dad relapsed again. Dad's going to lose his job. Dad's going to die. Dad's going to jail. Whatever those stories she made up. And, ultimately it became very apparent to me that inside of addiction medicine, it has always been focus on the alcoholic, focus on the addict, focus on the person that's causing the issues. And that person really needs to hit this proverbial bottom. At that point, they'll want it enough and they'll go get help. And the reality is that's just simply not true, and it's not a good way to approach it. The entire time, though, the family is living in dysfunction. The family has no idea what to do, and they're scared, and they're worried, and they're ashamed, and they're nervous, and they're angry. They're frustrated. And until that changes, until the family starts to get involved in the entire process of this addiction treatment, I don't think it's going to get truly addressed. And that was the genesis of youturn. It was how we've got to do something different. We cannot keep doing the same thing that we've been doing for the last 70 years. We've got to do something that brings the family involved. And if we do that, we're going to start to make some serious systemic change. And that's what we're trying to do here.
So there's millions of people who have dealt with some of the challenges that you just described. Not many of them decide to start a company to try to fill some of these gaps. What was it in your history and your experience that led you to believe, you know what, maybe I can be a part of this solution?
Yeah, sure. I mean, I think more than anything else, I'm an entrepreneur at heart. So youturn's my 5th startup. You know, I've done it a number of times. Always been in technology. So I felt like I had the skill set. As long as my head was clear, I had the skill set to create something. And I was super fortunate in that there's a nationally recognized nonprofit in Greenville, South Carolina, where I live, called Faces and Voices of Recovery. Greenville was named Program of the Year by the Department of Justice in 2018. It's an addiction triage, supported about 40,000 people over the last 8 years with entirely free services. So it's every demographic and every substance. My family helped donate money, helped start Favor. My co-founder Elizabeth was the original chairperson of the Capital campaign, and our third partner, Rich Jones, was the CEO of Favor for 8 years. We've all known each other, so
Gotcha.
you know, it sort of just came together from years of experience knowing each other, and then watching the good work at the nonprofit and just noodling on the idea, how do we take all the good work we did here, helping all of these families, all of these people, how do we scale this? How do we build it on a national level? And you can't, you know, I think it's difficult to do that in a nonprofit.
Yeah.
And I'm used to raising capital and getting investors and doing that. So that was really why I think I took the jump. And for me, this is a passion play. I mean, It's not about money. It's not about that. It's simply, how do we go help people? How do we take all this experience and really make an impact and help families that are just simply struggling mightily with this?
Well, that's a perfect tee up to what youturn actually does. I mean, you've talked about the problem. How do you actually meet families where they're at? How do you actually go beyond these sort of maybe outmoded ideas of meeting these certain benchmarks? How do you think differently about it at scale?
Yeah, you know, I think one of the biggest challenges with addiction is obviously stigma. Stigma is a huge part of addiction. We all know that. Because of stigma, people that are struggling don't go get help. The data is very clear that only 10% of the people that struggle with drugs or alcohol ever go get help. It's been that way forever, right? That's just the stats. And 90% of the people that are struggling they're going to go out tonight, they're going to get hammered, and they're going to make a mess. And that stigma stops them from reaching out for help. It stops the family from getting help. So addressing it in a different way is simply what's needed. So youturn is about providing families with a confidential platform to begin to learn. We're not trying to cure addiction. We are not the end game. What we want to do is help people get some education, begin to learn, particularly those that are at the very beginning of the journey, right? Meaning maybe they just found some pills in their 16-year-old kid's car. Maybe they've watched their wife slowly move from a glass of wine a night to 2 glasses of wine to now a bottle a night, and she's sleeping through getting her kids to school. You know, these are how the situations evolve, and it eventually it moves slow and then turns into a crisis. That shame around it stops people from getting help. So with youturn, we provide our platform to employers, to commercial enterprises, public sector. But the idea is that there's a ton of employees that are struggling with this stuff, but they are not the alcoholic, they are not the addict. I hate using those terms, by the way, they're super stigmatizing, but the reality is they're going home to it. Okay.
Well, Shay, what are better terms to be using?
We like to say the individual that's struggling, you know, the struggling individual.
A person struggling with
we try to identify
problem.
them as a person, yeah, because I mean, the reality is the majority of the people that are struggling with this stuff are people that have trauma, they've got issues that they didn't ask for, and they're simply trying to get better. They're trying to relieve their stress, their anxiety. And for, some people are going to eat chocolate cookies to do that. Other people are going to drink a bottle of wine. So one's not right or wrong, better than the other, whatever. It's just simply they're trying to get through life.
Yeah.
So these are individuals that are struggling. These are people trying to find help.
Okay. And you're primarily working with employers. How are
Yes.
you getting to people?
Yeah, we primarily work with employers. We are doing a lot of work right now, though, inside of treatment centers, so drug and alcohol treatment centers. Our program really revolves around the family. So one of our programs where we work with a treatment center called the Meadows, it's a nationally recognized treatment center. When an individual goes into the Meadows for treatment, the Meadows provides the family with our program for a year. So think about that. For the first time, the family is actually getting their own program, their own support, content, along with a family recovery coach that has, lived experience that can support the family while the individual's in treatment, but more importantly, as the individual leaves treatment and comes home. There is so much dysfunction in that. Yeah. So the Meadows is really taking the lead in providing a service like that. And at the same time, when the individual leaves treatment, we also support them with a peer recovery coach, and again, the youturn content platform, which facilitates communication. Inside of the employer space, though, what I've witnessed, what I've seen is an increasing interest in this space, an increasing interest, obviously, in employee mental health. There's still some disconnect, I believe, in terms of employers fully grasping the level of drug and alcohol use impacting them. And it doesn't have to be actual addiction, but sort of excess use of this stuff impacts healthcare cost, impacts resilience, productivity, a lot of mistakes being made, things like that. So we're working hard to help the enterprise understand all of these issues and really help them understand the primary problem is not the person at the office that's drinking too much. Like, look, that's an issue, and we want to help that person.
Sure.
But the issue is absolutely these employees that are going home to it. That is by and large the bigger issue. Pre-COVID, that was over 20% of the workforce.
Gotcha.
So you're talking probably 35 to 40% of the workforce, if not more, right now, are either personally dealing with this stuff, using substances in a risky manner, or the family is. So it's simply not anything that can be ignored anymore. And to assume that you don't have a problem at the company only because you're not dealing with DUIs or alcohol-driven sexual harassment, maybe the problem is there. It's just hidden, and you need to, company's got to deal with it.
It's really fascinating to think about the ripple effects and thinking it's not just the individual. This is sort of silent epidemic happening with everyone who's going home, like you said.
And it's, I'll tell you this, just a personal story. So at lunch today over here, sitting at lunch at the table with a couple other people, and we did the normal introductions. Hey, what do you do? What do you do? And I went through kind of what we do at youturn, and the young lady sitting next to me, super engaged with what I was talking about. And long story short, her mother is a heroin user. She's essentially homeless. And her two siblings, the lady I was talking with and her two siblings, address the situation very differently. Some won't talk to their mom, talk to the mom. She will. She gets pulled into financial issues. It's impacted her kids. I mean, it's unbelievable, the ripple effect. She started crying at lunch. Wow. She started crying, talking. I gave her the youturn platform to log on for free.
Wow.
But just to watch her, she doesn't struggle with drugs or alcohol, but she is watching her mom and is brought up in this, and it has crushed her life. She's never going to forget this stuff. So
there's no program, there's no treatment facility for the family.
It doesn't exist, man. I mean, it just doesn't exist because, again, we focus on the individual, and then in the meantime, the family's just sitting there shell-shocked, trying to recover from, possibly decades of chaos and dysfunction inside of the home.
Well, it's a good transition. I want to talk a little bit about the trends you're seeing here at Health. You talked about having lunch with somebody. This is an opportunity to really see what people are focusing on in innovation. And I think my first question is, what do you feel like is the understanding level when you think about mental health companies? You think about holistic companies that are really trying to see the patient as a whole person. What is the general appreciation that you're seeing for some of these challenges that you're talking about?
Yeah, so I mean, I've spent a lot of time.
Do they get it?
I spent a lot of time walking around talking to the mental health companies over the last couple of days. I applaud what they do. I love these companies. It's amazing to see professional money, venture capitalists, putting their money at work to create services that can really help employees around stress and anxiety and depression. I think we're just scratching the surface. It is so early inside of substance misuse. I think now that some of the mental health companies are really beginning to get scale, they're getting a lot of customers, they're talking to employees, they are now beginning to get the questions around drugs and alcohol. They're seeing that it is an underlying issue. They're not sure if the employee is stressed out because they're drinking too much, or they're drinking too much because they're stressed out, right? Who knows? Yeah. Well, until you sort of peel that onion back and start digging, you don't know. But the reality is you can't address one without addressing the other. So I think we're at the very early stages of companies like ours, and really the mental health companies beginning to expand the services into substance misuse. Every one of the companies that I talked to in the mental health space over the last 2 days said it is a key priority for 2022. Everyone. Most of them said they're going to try to roll out some type of program, at least in terms of alcoholism, but others as well. So no doubt we're moving in that direction.
You feel like that's what's coming next?
No question. I mean, just based on my experience talking with these folks, and and again, me out there talking to employers, I hear it now, but there's still not general acceptance that drugs and alcohol are an issue. I think frankly, human resources in general are just worn out, just tired and stressed, obviously from COVID, and then spending time trying to vet the mental health apps. There's obviously a lot of different choices. Bringing those apps into the company, getting it through budget, rolling it out, disseminating it, figuring it out, and they're like, phew. Yeah. Deep breath, like, please don't come talk to me about drugs and alcohol, Shay. It's the last thing I want to do.
Is part of it also that it's just so personal?
It's very personal.
The HR person themselves might have a struggle or a loved one.
For sure.
It's just the impact is so intimate.
No doubt, no doubt.
That it's easy to hit a wall with that.
There's always been this story that drugs and alcohol or alcohol, that's personal. What you do on the weekends, your business. You just come into work, and as long as you work and you perform, we're good. So, that's just been the way it is. I don't really know why that's the case. I think just the reality is beginning to sink in that if you have an employee that's struggling with drugs or alcohol, they're going to cost you significantly more than an employee that does not struggle with drugs and alcohol. There's enormous reams of data around that.
There is. Okay.
Oh yeah, absolutely. Both a 3-year study out of SAMHSA covering 25,000 businesses, and then the National Safety Council just did one. An employee with a substance use disorder cost the employer about $8,000 annually over an employee that doesn't struggle with this stuff.
Yeah.
It's hidden in the claims because the doctor's not diagnosing alcoholic. Right? It's not in the diagnosis, it's not in the claims, but it's there. It's in, absenteeism, things like that.
And that's just that individual.
That's just that particular individual.
That's not the spouse.
No.
Who's having to stay home.
Yes.
Too many times,
It just, the amount of time that gets eaten up by an employee who has a daughter struggling with opioids would shock people. They are simply not present, and they can't be. Yeah. If my kids struggle with opioids, I'm not going to be present. I mean, all I want to do is help my kid. So if I'm at the office and I have anything close to free time, of course I'm on Google trying to figure this stuff out. Yeah. That's not necessarily a good solution. Yeah. But yeah, there's it's there. I do think it is the emerging trend over the next couple of years. I certainly hope so. And I think that some of these mental health companies are in a really good position to bring services to bear related to drugs and alcohol, and I hope they do it.
So my understanding is that youturn, in order to scale and to reach more people, you're collaborating with other companies, and you have one of those sort of on display here. Can you tell me a bit about that merger?
Yeah, so we're working with a company called Heritage Cares. It's a subsidiary of Dallas-based Heritage Health Solutions. Heritage Health Solutions is an integrator primarily inside of the public sector market. They have 60 contracts with the VA. They also run all of the healthcare for the inmates of the U.S. Marshals. They've had that contract for 14 consecutive years now. So a lot of track record, particularly, inside of prisons, jails, and then the veteran community. And although those don't seem to match up, they actually do, because between jails, prisons, veterans, you've got an enormous amount of suicide, drug and alcohol problems.
Sure.
So Heritage saw that as an issue that needed to be addressed. And over the last couple of years, we built a partnership with them. We now, between the partnership, have this very innovative and comprehensive product that we can bring into the enterprise space, or the commercial space, I should say. And it just made sense to put the companies together.
Nice.
So we're merging. We ought to have this thing wrapped up in about 3 weeks. Super excited about it. It'll be CARES, powered by youturn. And I'm fired up. They're private equity backed. They've got money. They can help me grow this thing and
Cool.
put some gas in the tank.
Now, a big piece of what you bring to the table is education, correct?
Yes, yeah.
Is that mostly web-based?
Yeah, the youturn platform can be accessed from any device at any time.
Sure.
You don't have to download an app. It's web enabled.
Yeah.
And that's the coolest part about it.
I asked that because we're at a health tech conference, and I wonder what you think of as the opportunities that an advanced tech stack brings to addiction care. I'm thinking of a company like New Life Virtual, part of the startup health portfolio, bringing sort of the best of social networking and the best of app-based platforms.
Yep.
How do you see some of those things being helpful to what you're doing, if they are?
Yeah, no, they definitely are. I mean, we love the folks at New Life. We're working with them, and we're trying to figure out what the partnership might look like. I mean, they've done a great job creating a platform around building community for people that struggle with drugs and alcohol, creating tools that the therapist or the coach can utilize to engage the individual, setting up calendars, reminders, sending youturn content to facilitate communication between the therapist and the individual. There's a lot of ways for us to work together, particularly with New Life, but I see the same thing with virtually all of these mental health companies that are here. They need content, but more importantly, they need real expertise around substance misuse. So a group like us, where you've got 3 founders who are all in recovery from addiction, we've got this lived experience that I think is extremely important inside of this particular space.
Gotcha. I think a wrap-up question is kind of your forward-looking statement about 2022, what really gets you excited, where you see the company going next.
Yeah, I mean, without doubt, there's 2 areas where I'm excited more than anything else. One is the work we do with the VA inside of the South Carolina VA. It's just, it feels so good to help these folks. 16% of the veterans we work with score high to moderate on a suicide scale. 35% have high risk drug or alcohol usage. These are people that served our country, have already gone through a VA drug or alcohol inpatient facility, and they're still struggling. So to be able to help them, it just feels good. It means a lot. They deserve the help, and we love giving it to them. But in addition to that, the work we're doing inside of the treatment center space, a lot of different treatment centers, because they are bringing a solution to the family, and it's the first time I've ever seen the family truly get involved in learning how to keep themselves healthy, support the individual that's struggling. All of this is going to bring change to addiction medicine, and we will slow the multi-generational aspect of addiction, I have no doubt.
Shay, there's actually one other thing I wanted to mention or ask you about. A lot of the people who listen to our podcast are founders, are entrepreneurs, are leaders, and you have a particular style of leadership in your company because of what you've been through. You're very transparent about your story. You're vulnerable.
Mm-hmm.
You just told a story about talking to somebody and opening up in a way that brought them to tears, that they were able to share something hard in their life. Mm-hmm. And I wonder if you could speak to the role of vulnerability in leadership to the folks who might be listening to this.
Man, I don't know any other way to do it personally, but my very first boss, a guy named Leighton Cubbage, when I first got out of college in 1991, he was very transparent about his personal challenges. He had gone through a divorce. He talked openly about it in company meetings, and I just thought that's the way you did it. I just got so much out of it. I love this man. He's a beautiful human being. I still stay in touch with this guy, and I learned that way. But I think leaders telling their stories, sharing their personal challenges with the team, with the workforce, making it okay to talk about this. Why would you not do that?
Yeah.
Why would you not do it? It facilitates trust and it facilitates healing. If you share your story with employees, they will go to the mat for you no matter what, period. And if they know that you care about them and you love them, you got a company that's you're gonna succeed, period. You may not make a lot of money, but you will make a difference. And I think that's what we're trying to do here, especially the folks inside of health.
Yeah, it's fear. It's fear. It's fear of what people are going to think about you.
Sure.
What their perception will be, that you're not perfect.
That's right.
You don't have it all together.
Man, I'm certainly nowhere close to perfect. I'm just trying to keep myself glued together and make a difference.
Yeah. No, I admire, showing up as a human being and saying, look, my name is Logan Plaster, and I'm not perfect.
Yeah,
I've got problems.
Yeah.
And we could start there.
Yeah, that's it. That's it. Yeah.
Well, Shay, that's the time we have. I love what you're building. I love the way that you are leading your company with transparency, and the way that you're also deploying collaborations to try to bring the best of different solutions into something much bigger that can scale.
Yep.
So very excited to see what you do in 2022.
Awesome. Thanks, Logan. Great being here, man.
Thanks, Jay.
Yep.